Everyone knows that poor dental care can lead to cavities and gingivitis, but your oral health is also directly related to your general health. If your teeth are not properly cared for, it could lead to major consequences. At Redlands Community Hospital, Dr. Anil Punjabi discusses the dangers of bad oral health.
Bad oral health has significant health and systemic complications and consequences. Bad breath actually is one of the side effects which are quite significant, because breath which is exhaled not only comes from the mouth but also comes from the lungs. So it is a combination of the bacteria that are present in the mouth and the lungs that you're exhaling that causes the bad breath.
Dr. Punjabi examines when pain from a decayed tooth can start.
The pain usually starts when the dentine begins to get exposed. Dentine is the sensitive portion which is covered by the enamel, and dentine has tubules. These tubules then propagate these bacteria into the soft portion of the tooth, which is the lifeblood of the tooth, literally, that's the pulp. And the pulp is, of course, in an enclosed cavity. The pulp is in this hard surroundings, and when there is inflammation and there is swelling, there is severe pain, and there is no relief from this unrelenting pain unless and until you get it relieved by draining, either through a root canal or by removing the tooth.
Your heart can be affected by the bacteria growing in your mouth.
The consequences of poor oral hygiene, simply because of the very virulent bacteria that are present in the mouth. That's why human bites are amongst the worst bites that one can sustain. These bacteria can travel through the bloodstream into the plaques that are present, for example, in the heart arteries. These heart arteries, these are known as atherosclerotic plaques, which cause blockages.
Dr. Punjabi relates how dangerous bad oral health can become.
There are very dangerous consequences, because from the standpoint of my practice, I'm an oral maxillofacial surgeon. I see obviously the worst of the worst, but these are sometimes life-threatening. I've had patients in the ICU that had severe neck abscesses that started in the teeth, and these patients were not able to breathe, not able to swallow, and they had to have breathing tubes inserted so that they could breathe. Their respirations were supported, and then they needed to have surgery to relieve these extensive neck infections that started from the teeth. These infections can spread to the brain, happens not uncommonly in children, and not too long ago, this is one of the reasons why Congress passed a law that children's dental health would and should be covered in the Affordable Care Act, which is in force right now. Therefore, the oral health, the oral microbiology plays an important role in the health of the rest of the body.
There are simple steps for good oral health.
The simplest form of oral hygiene, of course, is brushing your teeth. Flossing is the next most important thing that a person can take responsibility for themselves. And then, of course, visiting your dentist every 6 months to get a cleaning at the minimum, every year at the least. It is important for a trained professional like a hygienist or a dentist to keep a watchful eye on what is transpiring inside the mouth.